Are you a medical graduate trying to clear Canadian or United States medical licensing exams? Then this channel is for you. Hi guys, I'm Dr. Didi from IMG Digest. I am an international medical graduate from India and I managed to clear Canadian and US medical licensing exams in the year 2021 and I'm currently pursuing residency. I'm here to guide, inspire and mentor you all to pursue your dream residency journey. If you're new to this channel, please like, share and subscribe. Your support means a lot to us. Now let's get this video started. I have been asked this question many a times by doctors who are trying to start their preparation for Canadian medical exams, especially QE1. So here is everything all about QE1 that you need to know to clear that exam. MCC QE1 or Medical Council of Canada Qualifying Exam 1 is one of the main exams that we take along with NACOSCI, which is a skills exam in order to be eligible to apply for CARMS. CARMS or CARMS stands for Canadian Residency Math Service. This exam happens 4 times in a year. There are certain specific MCC slots that are available on their website and you choose the website according to your own preference at what time you want to give the exam. This is a one-day, 2-part exam. It is divided into 2 parts. Multiple choice questions and CDMs or clinical decision making questions. The first slot is for MCQs, which is about 4.5 hours, 4.5 hours for 210 questions. It is followed by a 45-minute break. The second slot is for clinical decision making questions, 3.5 hours for 38 questions. Now in these 38 questions you may have various subparts, but the question number in total would be around 50 to 60. But that is enough time to finish clinical decision making section. This test aims to test your clinical knowledge as a physician, and the questions are mostly asked if you are a primary care provider. What I mean by that, the questions will be more focused on a specific clinical scenario and you will be asked to diagnose a patient or to suggest a particular treatment or any method of prevention or care you want to establish for the patient. For example, just to exemplify this, a 26-year-old female comes to you with a right-sided acute abdominal pain. In the question stem, they may also give you ultrasound findings. Let's say they say that there's a fluid in the abdominal cavity and ask you which test you want to perform. You are thinking on lines of ectopic pregnancy and the first test you want to order is HCG. But the questions will never be asked, or most of the times they are never asked from core theoretical concepts like which enzyme complex is absent from maple syrup sugar disease, or how many NADPH molecules are involved in Krebs cycle or glycolysis, etc. Please subscribe to this channel if you find this content helpful. I will be sharing more such content on exam related topics. 5 tips for cracking QE1. Tip number 1. Start preparing and planning early. You should define your timeline when you plan to take the exams. It can vary if you are a recent graduate or an old medical graduate. What's your background knowledge, what your familial circumstances are, and if you are doing a job side by side. I feel depending on your situation, 6 to 12 months of dedicated study is more than enough for this exam. Do not delay the exam, as more time adds more people to the competition and makes you feel anxious. Schedule your exam and start working on your resources after you have registered on Physicians Apply and begun the process of registering. I'll be taking a dedicated video on how to register for this exam on Physicians Apply. So please subscribe to the channel. Tip number 2. Keep time for revision and QE1 practice exams. Always keep time for revision and practice exams once you are done with your study material. I would say if you have scheduled your exams for, let's say, February 2024, you should have finished 1 round of QBank and all the study material by November end or December first week. Tip number 3. Your first chance is your best chance. Take the exam preparation seriously. Don't think that this is just a chance and you can always improve your score again. Remember, if you are pass, it's one final score. And unfortunately, if it's a low score, it can harm your chances to get a residency spot. Aim for a high score and study diligently, as if your life depends on it. Tip number 4. Keep your resources limited. Now there are many resources out there in the market and one may feel overwhelmed of how much to study and from where. When we are giving the exam, it's very important to trust universally accepted and standardized resources. I suggest keeping one standardized QBank and 1 or 2 books that you can refer to. Always remember, hustle smarter, not harder. Tip number 5, prevent burnout. It's very common to feel frustrated, depressed, as the journey is very hard, long, and unending. But you need to keep faith and believe that it is possible. Visualize yourself in the dream hospital pursuing your dream residency. Can be in Canada or in US, and doing what you always wanted to do. Always take care of your physical, mental, and spiritual health. Coming on to the resources. Question bank. I personally used UWorld Step 2 question bank for this exam. It's a very comprehensive question bank and has excellent explanations that are very easy to understand. Now I know many of you will think that it is for the US exams, but the course material and topics are same for both USMLE Step 2 CK and QE1. I'm not paid here to say all good things about UWorld, but I found it super helpful. If you think you like Canada QBank or ACE QBank, you can go ahead with it. I have not used it and personally have no experience with that. Coming on to the books. I personally used my question bank as my main resource and had a question-oriented approach to my preparation. My time was limited, so I had to use question bank as my main resource. I refer to Toronto Notes for selective topics. It's a great book and is very specific to Canadian medicine, but it has a lot of theory to it, and I found it hard to retain so much of text. I selectively used it for some very important topics. I'll post a video very soon how to use UWorld question bank for QE1. I'll post a video very soon on how to use UWorld question bank for QE1 and how to read Toronto Notes selectively for QE1. So please subscribe to the channel if you haven't done so. If I found some hard topic that I was unable to understand, I used Master the Board Step 2 CK and First Aid Step 2 CK to clear my concepts. The third resource that I referred was MCC QE practice assessments. This I recommend buying only when you are done with your QBank and are now looking to assess your preparation. They are an expensive resource but totally worth it as it gives you a very good idea. If you cannot buy all the practice assessment exams, try buying at least one full-length assessment exam to give you an idea where you are, if you are ready to take the main exam or not. What is a good score in these exams? I would say if you're getting 65 to 67% or more than that, you are ready to take the exam. Okay guys, that's all for this video. I'll see you soon in my next video. Keep hustling and keep studying.